Welcome, everybody. I'm trying to give a talk that I was going to prepare for next week, so it may not be as complete as I wish. I apologize for that. I want to talk about the profession of medicine. I want to talk about professionalism, which is why I want the new residents to hear this, which is, I think, very important. I want to talk about what a profession is, where we are in neurosurgery, and how we got there. So it's important to know that this is, a really phenomenal institution. The things that have happened at Wisconsin and the scientists, professionals, vitamin D, anticoagulation, brain edema treatment, digital subtraction angiography, medical physics of imaging, it's all from here. It's really a fantastic place. The problem is that it's also a place of human beings, and that has both good and bad. We're talking about how we got to be professionals, and it's really about the legacy of how these things developed. I talk about neurosurgery because neurosurgery is this very young specialty. You are literally this many generations from the start of neurosurgery. Cushing, 1904, really defines neurosurgery. His trainee Ray, his trainee Hoff, his trainee Dempsey, and you all. That's where we are in a very young specialty. Yet it is a rather important, I'd say, keystone specialty in medicine, and it is, as a profession, kind of an ideal example of that. Yet here at UW, we've had these issues which are important, which remind us that professionalism is something we must work at continuously. Complaints of harassment, inappropriate behavior, and the latest problem is minority physicians being harassed by patients. It's a difficult world, and it's a difficult world to have things like that going on. So can professions and professionalism exist? Well, what is a profession? This is really thousands of years old. It separated laborers from a higher standard. It really took it from being work to being an avocation. So it always included a specialized fund of knowledge or skill set, standardized training, which would be important and had to be learned, and would be regulated. That meant that the regulation would be internal by the group, not external. And it meant that internally set standards and expectations would have consequences. So when we see other organizations or medical organizations in other countries being regulated by the government, they're losing their professional status. What we have is a self-regulating. The Board of Neurosurgery is made up of neurosurgeons. When the government says there's a problem, we respond to it. And that separates you. The medical ideal is that it be very different from other professions, the profession of law, the profession of engineering. In the Middle Ages, these were guilds. Painters became professionals by having standards, by meeting together, by self-policing, by teaching. And a professional physician must realize that it's very different than just doing your metal work well, because you're a public servant, which has a stabilizing force in society. This is really what the Board of Internal Medicine thinks. In reality, medicine is a very maldistributed, multi-trillion-dollar industry that's capable of great good and great bad. Self-destruction from greed, self-interest, exclusion of other people. I'll only operate on people that will pay me. Harassment, we talked about that, and pride. So how do we maintain that in this world, in this need? Well, when we deal with distant maldistribution, we try to do something about it. And that's really part of our lives. It's part of what we can do here in Wisconsin. And it goes back to Hippocrates. Let your disposition be that of honor. Behave with a friendly and easy spirit. He was the first person in medicine to talk about this as a profession, to talk about the way you work, not just what you did, and your motivation. And that's what's going to define a profession. Sir William Osler, the great Canadian medical expert of the turn of the last century, said, we're not here to get everything out of it. We're trying to make the lives of others better. It's an art, not a trade. It's not a guild. It's not labor. It's not a business. It's a calling which your heart is as important as your head. He was the great, really, person who transformed medicine. Was his colleague Cushing, which transformed all of surgery while he was forming neurosurgery. Indeed, it was his image that transformed the understanding of what a doctor was. And therefore, professionalism has to have standards of practice, ethical responsibilities, and imperatives such as diversity. And by that I mean in your practice and the delivery of your practice. So diversity in neurosurgery always means you do the best. You don't do the one surgery you know. You are constantly learning. You're constantly looking to be as broad-based as possible because your patients need it. You look at equitable. Do we serve the people in need as much as we serve our own family? And that's really the standard we must carry on. And the responsibilities that happen are remarkable. This, a mother places their child in your hands. That's their life. And I began to learn how important that was. And I began to learn how important the profession of medicine is when I watched these medical students in Ecuador interact with this teenage mother who was afraid of the doctor, but the young doctors, meeting them on their level, sitting with them, that was a professional. And that was students teaching me about professional conduct. And because the world's very existence is essential that medicine play a role. In war, in refugees, in everything, we have to play a role. You cannot have care without medicine, and you cannot have many bad things. Capital punishment and torture. Always you'll find the medical profession is involved. It never should be, and that's my standing. So what is this? It's imperfect, it's multi-trillions of dollars. It will be changed by standards of professionalism, which have to do with achieving technical excellence, having compassion, avoiding greed. And you cannot meet that without these standards. So let's take them apart. These are the elements of a professional. Suspension of self-interest. Why are you doing this work? If it's simply to better yourself, don't sell stocks. If you suspend your own interest and put the patient first, that's why you're there in the middle of the night. It's honesty, and the honesty is tough. We have tremendous buffers built in. It's very hard to be honest first with yourself. Did you screw up? Could you have done it better? Now, some people are too tough on themselves, but the honest people realize we're imperfect, and the answer is, are you trying to get better? Technical competence, that's the part of this profession which really goes back thousands of years. Surgical competence is not a gift, it's something earned. Authority is really a very real part of your profession. And you talk about decreasing levels of authority, but you never will completely, because you must be the person accountable for their care, and you must learn to communicate. I'll talk more about that. Justice is important. Justice invariably means that you are providing the same care to others. And humility, important part of professionalism, sometimes almost completely lacking in the surgical specialties, yet it needs. So how do you teach it? First, you understand it. You understand where it impacts your career. It isn't a test you take at the end. It's every single day. So in the medical schools, in our nation, in our world, it has to do with the example you set and the people whose lives you transform. That's where the teaching comes. suspension of self-interest. Who do you serve? When you see a medical system excluding people for convenience or reimbursement, they have lost their professional standard. This includes the very insurance companies that we deal with and one which we own as UW Health. So we must be directive to them about exclusion of care is unacceptable. Honesty and competence. This is John Sandon. John Sandon was the most remarkable resident because of his thirst for technical competence. Practice, practice, practice. He had a natural gift for it, and we honor his legacy with the Sandon Award. It did not come beyond that gift. Michael Jordan had a gift, but he practiced harder than anybody else. And that practice is what's part of a professional. Education is the most meaningful gift because not only will you improve, but you'll set the example for legions of doctors, med students that will improve. That's where it comes in. Authority and harassment. What separates this man, Buzz Hoff, from other leaders in neurosurgery was this idea that he attracted professionally. Harassment takes place in many ways. We have doctors being harassed because of their gender, their religion, their color. We can't allow that, and vice versa. We cannot harass person by rank. There's nothing I will get on top of more than people yelling downhill. You deal with people at your own level or above. You teach the people below you. If you have a problem with another department, you talk to the person at your level who is responsible for that person. The patient is your responsibility, but so is their family. We cannot do our job well unless we are willing to remember that, especially in neurosurgery, you may never be able to talk to your patient. The family is part of your patient, and you deal with them, you talk to them. You call them in beforehand if you're able to. You round on them as well. The other, I've made this comment many times as we talked about the riots that have been going on in the demonstration, that this idea that someone else is different from you and therefore you are superior is a real perverse notion. It has nothing to do with the profession. There's no place. So even as med students you're teaching, doctors impact everybody they touch, positively or negatively. People are watching you, and every interaction, every intervention has this terrible authority. That's what a profession is. You do not want to give that away. You want to embrace that. How am I impacting on the students, the cleaning lady, the people that turn the rooms over in the OR? Why don't I stop and give them a good word? Why don't I make their day a little bit better and show them how important what they do is? You can do that as a medical student. You have to do it as a doctor. You must do it as an attending. And you teach at every level. I love this picture because the teaching is going on at every level, nurse to nurse, anesthesiologist to anesthesiologist, doctor to doctor. That's what we do. And the teaching is so strange. These medical students traveled across Ecuador just for teaching rounds. And indeed, they wanted to learn about baseball as well. But they are the ones that taught me, how did they gain this young mother's confidence that this child needed surgery? And how did they spend time? How did they sit at her level? And how did they be with her until she became confident of their compassion, their professionalism? And they vouched for me. That was different. So you spend time. How do you communicate? You set aside time. People ask me, can we tape you getting an OR permit? I say, which time? Because if it's an elective case, want to make sure they understand. 2 people today, I postponed surgery because they weren't ready. Your language must be clear. I want to know the social history of the patient so I can understand how do I term things. Do I talk differently to a university professor or a laborer? I do. Do I get the same information across? I must. The words may be different. The background may be different. I address the patient. I don't address the computer. I address the patient. I understand the reaction and I respond to that because I listen. That's my goal. I'm not saying I'm good at it. I'm saying that's what I must do. Because most communication is nonverbal, and the patient will tell you, you have to pay attention. So how you listen, how you dress, how you present yourself is vital. If they're unnerved, you may use humor, but it has to be very careful to bring them to a more relaxed state. To have them understand that you care about them. You go to their level, and you show this justice, which is compassion, equitable distribution of care throughout. This is Ecuadorian doctrine. And justice is also cost effective. It is not justice if we are burning the world's medical resources. Global medicine needs to improve, and we need to not be satisfied. That's what research is. That's you're never satisfied with what you're doing. That's part of justice. That's part of professionalism. That's part of training. And modern medicine's responsibility is great, but we need to push it. This is my work where we hope to move toward regenerative neurosurgery. It'll happen during your careers. Humility, it's a lost art. It would eliminate harassment if we understood we stand on so many people's shoulders. We get lots of kudos because we're neurosurgeons. It doesn't mean much because we need everybody else. And the people that clean the rooms are just as important, and don't be afraid to show them that. Every job can be a profession. You have to earn it, however. You can make it the highest standard or the lowest. And it's really telling that in the course of really the last months, some of our first providers, some of our first responders went from being the height to the depths. And that was based on murderous, unprofessional activity. And that changed that whole profession for policemen. That's unfair. We need to re-elevate what they do on the standards of justice, humility, compassion, training, self-regulation. So, how do you earn professionalism? Work ethic. You're punctual because other people rely on you. When you're not, they basically are put off or they've worked hard. You're accountable. You own up when there's a problem. I do not want to discover a problem when another attending in another service tells me about it. I want to hear from my team, we have this problem, this is what we're dealing with. You're competent, you practice, you're diligent. This nurse brought this baby from the mountains of Haiti down to our clinic. She had been tapping this child's fontanelle for a month to keep that child alive until we would come to the country. It's amazing. It's just unbelievable that she kept this child alive in the mountains. It really humbled me as to how unimportant what I do is compared to everybody else that builds what we do. So the character of your behavior will make your reputation. You base it on ethics and teamwork. You are intolerant of harassment when you speak up and you serve. How you do, how you act, it'll affect your patient's confidence and their outcome. If they are confident what's going to happen, if they know they'll be numb near their suture line, they won't be frightened. They know how much pain they're going to have, they will minimize it. This is what I expected. And that happens every day in the clinics, in the hospital, on the medical missions. You earn it daily because people expect it of you, and you act that way. That's a professional. So what I'm asking you is to be a great doctor. And I'm going to explain what I think that means to finish that up, because it's really something that I sort of stopped and looked at and said, well, what makes this doctor great and that? This one's smarter? Usually not. This one's more diligent, perhaps. This one knows how to find the answer. This one won't stop. So what does it mean? First of all, great doctors are in love with what they do. Abraham Lincoln said, folks are about as happy as they make up their mind to be. If you decide that this is the greatest profession on earth, you're going to enjoy every day. You're going to laugh, you're going to work hard, you're going to be serious when it's serious, you're going to be lighthearted when it's lighthearted, you're going to love what you do. And that is always telling. If you're not, think about why you're here. Change it, because it is a great profession. Don't ever be jealous of other people because they have more free time, etc. If you're doing what you want to do, you never work a day in your life. Great doctors are creative. That means they're not satisfied with what they got. They want to do research to make it better. This is the huge advantage you have. You're one of the great research institutions in the world. And these are collaborative people who love what they do and would love for you to make it relevant to people or medicine. The basic scientist collaborations here are great. Be creative. Think every day, how could I do it better? Take it to the lab. We will build that lab for you. All great are mentored. I don't care if it's in music or if it's in art or if it's in surgery, it's in neurosurgery. You have role models, you have teachers. Search them out. Spend time with them. Ask questions. Rarely do you learn anything by passively listening. You learn things by asking questions, helping to find answers. The best you could be was you ask a question, you say, well, you're going to teach us. Let's do that. And that's how this lab came to be in the first place. Great doctors are teachers. Docere means teacher in Latin. And you can be taught so many ways. This child, this actual child in Guatemala, taught me that I needed to teach doctors to be there when I wasn't there. She was healthy. So great doctors teach what they do, and that's how they learn. And you teach everybody. Teach your scrub tech, teach your nurse, teach your patients, teach their families. They will respond by taking control or command of what they do. And if a patient takes control of their health, they're going to take their medicines, they're going to stop smoking, they're going to change their habits. And that's what you're trying to do as a doctor. Great doctors have integrity. Integrity is Latin for whole, like an integer, it's a whole number. It means you take complete care of the patient. You look after their heart, their lungs, not just their organs you operate. You don't just do one surgery. You find many ways to fix a problem. You do what's best for them. And so the complete care of the patient and their family and their knowing their social history and finding the social worker that might solve their problem is taking care of them. That's what patients appreciate. The technical part, they can get a mechanic to do that. And you will be a very good technical surgeon. I want you to be a complete doctor. Great doctors are great people. They love what they do. They care about people. That is partially the way you came, partially the way your family made you, but you have complete control over it. How do you lead your life? What are your standards? What makes a great person? Well, it's hard work. It's complex. It defines your life in an extremely positive way. Something that other people are jealous. They have this much meaning in their life. What do you value? What's your purpose? What can you give back? Well, for me, it's these three parts: patients, family, and values or faith. The value system, the patients is obvious. But family is a trusted person or persons you can be honest with. You set time aside for those values, which can be theologic, they can be a value system, but they're what keep you on your right path. And when you deviate from them, when you are cutting corners, when you should be spending time with the patient, that honest person, which I call family, will call you out. You never, ever break with that person or family. If you've got problems, you get them solved, because you need them. And you be aware of the risks, dangerous hobbies. You are, as neurosurgeons, ridiculously well paid. People tend to bring out the best and worst in people. The sudden accumulation of wealth, famous quotation, brings out the true value of a person. Dangerous hobbies, which occur usually 4 to 6 years after you finish a residency, are a clear sign you're losing your compass. Be aware of that. That's your value system. Because if you look at this full model of what is a profession, what is neurosurgery, it is, I believe, the highest profession. It is, I believe, the greatest job. Certainly for me, because I don't think I've ever worked since I left the loading docks. And I still choose to recommend medicine. People say too much insurance forms, too much. It's always been like that. I understand that anybody that is patient-directed can be a great doctor. And if they have an intellect and they use it, they could be a truly great professional. There's an immense possibility for benefit and a life of satisfaction. So I believe that as professionals, as doctors, I believe in you. Believe in yourself, aim high, and as Hippocrates said, let your disposition be that of honor. That's what I expect of people. This is July. For many of you, it's the start of a year of medical school or a year of residency or a new career or just a new phase in your life. Don't waste it. Make it the best. You are very lucky to be in this profession. Thank you.